few of us that were here and maybe possibly remember. Uh, If there are none, I will entertain a motion.
So moved.
Second.
All right, all in favor?
Aye.
Opposed, same sign. Thank you. The minutes from the November 2024 meeting have been approved. In July, the Criminal Justice Institute entered into a memorandum of understanding with the governor's office for our team to continue to assist the coordination of the state's efforts in response to the drug epidemic, providing planning and collaboration across state agencies and at the local level. As communities across Indiana are receiving opioid settlement funds, this work is vital to ensure that local units of government are aware of best practices and are utilizing funds and ensuring compliance with our settlement terms. Before we get into today's presentations, I want to take a brief moment overview for some of you that may be new to the conversation. This is where we start on page 3 of the presentation that's in your packet. So far, the state has secured $1 billion in settlements with distributors, manufacturers, and marketers. And when we refer to the opioid settlement, we're actually referring to a dozen different settlements with separate payment timelines, separate terms, and separate compliance measures as well. All of the payments are spread out over 18 years, beginning in 2022, and are currently stated to end in 2038. However, this does not include the Purdue Pharma settlement, which is likely to be around $100 million to Indiana over the term of 15 years. And I think one thing that's important to remember is as these payments come in, many of the settlements are front-loaded and or are one lump sum payments. And so there's a curve to the payment timeline. And as we get further out, we'll likely see less money coming in. So our goal is to ensure that we're educating our locals as well, not to have a funding cliff as we get later into the payment terms. The settlement distribution formula on slide 4 is determined in Indiana's code. And so settlements are received by the Attorney General's office and distributed through the comptroller. 50% goes to the state of Indiana. 35% of that is abatement funds or restricted funds, which are automatically appropriated to the Family and Social Services Administration. They develop a plan, and those dollars, that plan is approved by the State Budget Committee. 15% is unrestricted funds and is appropriated by the state legislature. And then the other 50% goes to locals, where 35% of their 50 is local abatement or restricted, and that 15 is then unrestricted, and they can spend it anyway on anything that they would like. Shelby Thomas is the Director of Public Affairs and Substance Use Policy at the Criminal Justice Institute and leads the state's work with local units of government, and we'll kick off the presentations today with a report on the local spending.
Thank you, Chairman Hunsing and members of the commission. As he mentioned, I'm Shelby Thomas, serve as Director of Public Affairs and Substance Use Policy at ICRI. Since Indiana received its first payout of the National Opioid Settlement in 2022, the state has worked diligently to keep stakeholders and the public informed about the dollars coming in and how they're being used, both at the state and local levels. This morning, I will be speaking to the 50% of funds dispersed among the 648 local units of government across the state. My colleague from the Division of Mental Health and Addiction, Kelly Walker, will soon address the state's 50% share. So on slide 6, you'll see that in addition to defining the distribution structure of the settlements, Indiana Code 4-6-15 also includes a special provision that if a city or a town's annual abatement distribution totals less than $5,000, those funds roll up to the county. This was amended in 2023 from a $1,000 annual threshold. And so you'll see kind of that impact here in a moment. The same section of code also outlines how abatement funds may be used by both the state and locals, restricting expenditures to programs focused on treatment, prevention, and care that are best practices as defined or required by the settlement documents or court order. And that brings us to Exhibit E. So Exhibit E is a guiding document that's attached to most of the opioid settlement agreements. Exhibit E provides a detailed list of allowable uses for abatement funds. The state uses this document to guide all settlement-related decision-making, and we emphasize locals to do the same. Local unrestricted funds, however, are not bound by these requirements and may be used at a community's discretion. Still, many communities choose to voluntarily align all spending with opioid abatement goals to maximize that impact. Slide 8 shows, I outline kind of how local spending decisions really rest with the local decision-making bodies. So city council, county commissioners, or another governing entity. The state encourages communities to establish a local advisory council to assess needs, guide discussions, and propose solutions for investment. In some communities, this responsibility is delegated to an existing group, such as a local justice reinvestment advisory council, a local health department, or a local coordinating council, while others have created entirely new bodies specifically to oversee the settlement funds. Soon you will hear from the Montgomery County Local Coordinating Council, who has been charged in their community with overseeing the settlement distribution process for the county. Under Indiana Code, the Family and Social Services Administration must submit a comprehensive annual report on how all opioid settlement funds are used, and that's due October 1st of each year. In 2023, we collected our first round of local reports, receiving 606 submissions of 648, with 19% reporting expenditures of abatement funds. Using a reporting platform at that time that was built in-house, we spent considerable time contacting clerk treasurers and auditors to collect the reports. To improve the efficiency, we partnered with a team of engineers and consultants at Aegis to develop a robust reporting platform, offer technical assistance, and streamline submissions. This resulted in 644 completed reports last year, with 20% reporting abatement expenses. This year, we received reports from 630 of 648 local units of government, covering fiscal year 2025 activity. Those 18 local communities that didn't report are very small communities. In some cases, they have a volunteer clerk, treasurer, or auditor, and they're receiving very small amounts of funds. So of these 630 localities, 178 or 27% have never received abatement funds to date since 2022. That is because the amount that they are receiving falls below that at the time $1,000 threshold and now $5,000 threshold. 154 localities received abatement funds before that $5,000 threshold was established. So under that, just above $1,000 in that first year. So they may still have expenditures reflected in this graph. Because they spent funds that they received earlier in fiscal year 2025. So for this cycle, 23% of localities reported spending abatement funds, while 47% received abatement funds but did not spend any in fiscal year 2025. This does not necessarily mean that they haven't spent funds previously. However, our current reports only capture data by fiscal year. And this is something that next year we plan to expand our analysis to really identify how many unique localities have spent funds to date since receiving funds at the end of 2020.
Shelby, before you move on,
Yeah.
really quick, the 27% in the grant on the breakdown of restricted funds, is that the 27%? Did that roll up to the county?
Not sure. Yes. So in that case, they rolled up to the county. Correct. For clarifying that. So regarding unrestricted funds, 24% of localities reported expenditures, while 73% did not. Every locality does receive unrestricted funds regardless of the amount. And I say this because some communities receive $2 and have received $2 to date. So this is a little misleading when you look at no funds expended, because if you're receiving $2, what are you supposed to do with it? We've also asked locals to identify whether they have established a committee to oversee settlement spending, and 103 communities, or 60%, reported having such a committee. And notably, many of these are the same communities who have spent their funds or have reported at least one expenditure. So I'd like to take a moment to dig a little bit deeper into these numbers, address a few common questions that we received. Probably most notably is, why are only 150 communities of 648 spending the restricted funds last fiscal year? And there's really a few reasons to consider for this. Smaller communities receive smaller distributions. For instance, among the 470 localities that have received any abatement funds since 2022, 147 have received less than 100,000 over multiple payments over those multiple years. Many of these communities are intentionally saving their funds to make a larger impact in the future, and we're also beginning to see momentum. Several communities have opened grant programs to distribute funds locally. You may have seen, I believe last week, City of Fort Wayne recently awarded $1 million in settlement funds to organizations throughout their city. A success that that'll be captured in the 2026 report, just because that just happened. The other question we commonly hear is, what is the state doing to address communities that may not be using their abatement funds in accordance with Exhibit E and those settlement requirements? At this time, state does not have statutory authority to enforce how local funds are spent. However, we are actively working with Corey and the Attorney General's office, as well as the State Board of Accounts, to explore reasonable approaches for ensuring compliance across all localities. To date, our strategy has really been educational rather than punitive. We've worked closely with our partners at the Association of Indiana Counties and Accelerate Indiana Municipalities, or AIM, to distribute resources. We've hosted webinars with various stakeholder networks. And last year, the commission adopted recommendations to help guide local spending decisions. And we continue to meet regularly with local officials and organizations to really provide that one-on-one support and answer questions they may have. This process has taught us anything, so there's really no one-size-fits-all approach. Each community faces unique challenges, but we all share the same goal: to ensure these dollars make a meaningful and lasting impact on users. It takes time, but we're making progress, and I'm confident that these funds will continue to improve lives and strengthen Indiana's response to the drug epidemic. At this time, I'm happy to take any questions.
Questions for Shelby? Please.
Shelby, are you seeing regional approaches to using the funds? And if so, what have regional strategies? What have they looked like?
I think regional approaches are difficult because people want to work within their county line. Getting even the county to work with the cities in their county is difficult. And so we've encouraged regional approaches. However, we also recognize that sometimes that's just not feasible. We also, when we encourage communities to, create a local needs assessment, look at what is in your neighboring counties, because oftentimes not every county needs a treatment program when just a few miles down the road, there's another one in the neighboring county. And so really take into account what's available in your region when doing that local needs.
I'd like to make sure I'm understanding your chart correctly. So let's look at slide 10. What year is that from?
So this looks at fiscal year 25. However, that green portion, the 27% that have not received restricted funds, that is over the period of time that we've been receiving funds. So since 2022, this really just looks at fiscal year 25 and what was spent in 25. However, those funds could have been received earlier.
Okay, so the 73%, that represents what amount of money?
73%. The no funds expended, that represents the unrestricted funds. And so again, that's that 15% of funds of their 50% that they receive.
50%, right, but from a dollar perspective, how many actual dollars?
That is something that I can get back to you.
Any other questions?
That information's on, the Attorney General's website. I think it's on your website too. It's in a Excel spreadsheet, but we can get that information to you.
Thank you.
Yeah, we can pull up the data that we get on a fiscal year and the timeline of the payments that come in and who has spent their dollars and how they reported it to us. We can get you a number. It is a different number depending on how we factor in the different things. So we can get you a number. That would make sense.
Just go to her. They'll get it to me.
Quick question too.
Yes.
Are there many communities that are receiving, less than $100 or a few dollars that, they can't really do anything substantial with that?
So that's where the $5,000 threshold comes in, because we recognize that really, I mean, that is such a small amount of funds. And so that's where that rolls up to the county. And when the counties are receiving, municipalities' funds because of that threshold, we encourage the counties to work with their local communities to ensure that those are in fact impacting still that local.
Okay, thank you. So over the past few years, we've invited communities and organizations to share how they're using these dollars, creating opportunities for others to learn from their successes. And so today we're joined by Diamond Justice, who's the director of Drug-Free Marion County, and Karen Branch, the director of the Montgomery County Youth Services Bureau, who are going to highlight Montgomery County's collaborative model, which has enabled them to successfully allocate 100% of their funds that they've received since the first payment at the end of 2022. Welcome.
Good morning, everybody. As I said, I'm Karen Branch. I'm the Executive Director at the Montgomery County Youth Service Bureau. If you all are not familiar with youth service bureaus, there are a number of us across the state. Our primary goal is delinquency prevention. And in Montgomery County, what that looks like is 11 different programs that we operate. A number of years ago, through a variety of circumstances, we ended up absorbing the Drug-Free Coalition, or the LCC, for Montgomery County. So it is now a program under our umbrella. Because I figured when you started, you're going to be like, why is the Youth Service Bureau here? And it's because we have taken on that responsibility in our community. So the star of the show today is Diamond, who is our coalition director and has been in that position for 2 years and has really allowed us to advance the way that we have with the approach she's going to talk about today.
Like Karen mentioned, my name is Diamond Justice, but first I wanted to thank you all for having us here today. This is a huge opportunity for our community and LCCs like ours across the state of Indiana, so we're very grateful to be here. Like Karen said, I'm the coalition director for our LCC, also known as Drug-Free Montgomery County Coalition, and we are a program of the Service Bureau. Also in my role, I serve as the facilitator for the Montgomery County Opioid Settlement Funds Leadership Team, which is what I'm here to talk to you guys about today. I included a packet that everyone should have, and it covers just a few highlighted documents that I'll be mentioning today. I just wanted you to have that in front of you. It covered our initial project proposal timeline, so our very first timeline of proposal we created, the list of members of our leadership team that we could see the names, titles, and organizations, and then our community assessment needs table that we conducted before the distribution of funding started, as well as the exhibit E that we used during that community needs assessment. This leadership team was established in 2022, and it is the subcommittee of our LCC's leadership team. So we just pulled a smaller committee from that leadership team for our LCC. In November of 2022, this smaller team was authorized by our Montgomery County Commissioners to create a plan to utilize the opioid settlement funds through our Drug-Free Montgomery County leadership. When creating this plan, the Opioid Settlement Funds leadership team spent time working with our county administrator, Tom Klein, who also sits on our committee, as well as our county auditor, Mindy Byers, to develop our plan to ensure that it was efficient. Along with this, the leadership team presented at each Montgomery County small town board meetings to ensure that each town was aware of the funds and that we made sure each town felt included and aware of the processes that we were planning to take part in. In February of '23, the Director of Montgomery County Leadership Team conducted a community needs assessment to see where our gaps were in our community. We used the Exhibit E document, which is at the back of the packet, that shall be mentioned as well, and that just covers the approved uses of the funds of the restricted category. And we use that to create a needs assessment so that we can target our priority areas a bit more efficiently, for our community specifically. At the same time, DMHA announced a matching grant opportunity associated with the opioid settlement funds. And in late February, our Montgomery County Commissioners approved the recommendation for opioid settlement funds to be used for a $30,000 match grant opportunity for our local nonprofit organization entitled Recovery Coalition to purchase their building in full. This decision was made after this organization was successfully awarded a state grant to purchase that building, which required the match of opioid settlement funds at the time. After the conclusion of our community needs assessment, our leadership team was able to create a plan and a proposal for the Montgomery County Commissioners. This proposal includes annually awarding opioid settlement funds, mini grants, to local organizations who are actively working to address substance use in Montgomery County. Grant applicants must identify how they will address the priority, one or more of the priority areas that we listed out in the community needs assessment. And those categories include education and prevention, intervention and treatment, law enforcement and criminal justice, as well as harm reduction. The available amount for mini grants each year will be dependent on the amount of funds available in the restricted account as of July 1st of each year, which you can see on the timeline in the packet. But I do want to note that we have since made an adjustment to that timeline to reflect that date as of June 1st and not July 1st. That worked out better for our timeline in terms of meeting with the commissioners, getting approval, and the rest of our funds processes. For example, the amount available for the opioid settlement funds mini grants for 2026 were based on the funds that we received or were reported July 1st, 2024 to June 1st, 2025. That just makes sure that we are able to have a correct and accurate representation of the funds we are presenting to the commissioners for that final approval at the beginning of June of each year. Grant applications are typically announced on August 1st of each year and are due at the end of that month of August. Grant applications are reviewed and scored by an independent grant review team in September of each year. Once the review team has created their recommendations, we then take those to the county commissioners for their final approval. If we are granted approval on that day, award notices are announced immediately. We do this so they have enough time to do what they need to do, get things done, as well as for a press release as well, because we like to share with our community what we're doing. At this point, awardees must sign a grant agreement that outlines the terms and requirement of the use of funds. This is typically due by mid to late November in our timeline. This grant agreement includes requirements such as attending a certain number of LCC committee meetings, attending our annual Red Ribbon Breakfast that we hold in October, submitting mid-year reports and end-of-year reports to our leadership team for review, proper and appropriate use of funds, etc. From this point, claims can be submitted to our auditor. We work very closely with her to ensure that it's a seamless process. And then we conduct a check presentation and photo op with our Montgomery County Commissioners, and funds are awarded at that time and are meant to be used from January 1st of that year to December 31st of the year. To ensure this process runs smoothly and appropriately, we have a very dedicated leadership team, like I mentioned, and we meet throughout the year to make adjustments as necessary and to make any evaluations that need to happen. And again, they are a subcommittee of our LCC leadership team, but they are made up of stakeholders that represent key areas such as mental health, youth services, local government, addiction services, local schools, probation, etc. And I included a list of them in the packet as well. Those individuals are Andrea Geigel, Chief Probation Officer for the Montgomery County Probation Department, Adrian Northcutt, Administrator of the Montgomery County Health Department, Karen Branch, Executive Director of the Montgomery County Youth Service Bureau, Tom Klein, County Administrator for the Montgomery County Government, Amber Reed, Director of Food Service and Student Wellness with one of our local school corporations, Macy Simmons, Director of Addictions and Recovery Support Services with Integrated Wellness, Samantha Mitchell, Director of Mobile Integrated Health, Dale Crowder, Director and Licensed Psychologist in Valley Oaks, and myself. As we are moving forward, we are now entering our third year or our third cycle of this proposed plan, and we've been successful, thankfully, each year. For the 2024 cycle, the amount available in that restricted portion that Shelby mentioned was $146,963.17. For the 2025 cycle, the amount available was $191,608.47. And then for this most recent cycle for 2026, the amount available was $147,197.62. And we are very proud to share that every cent of the funds available in the restricted account each grant cycle has been expended to the fullest amount. So we are very happy to have every cent expended into our community. Funds have been awarded under various projects under those 4 categories I mentioned earlier. These can include peer recovery services, treatment core support, emergency needs funds, hygiene bags, treatment support for individuals who are uninsured or underinsured, DARE and SRO trainings for our law enforcement officers, community resource navigation services, staffing support, and prevention program for youth or substance use education programming. Because of these funds, many local organizations in Montgomery County have been able to expand their services and access to resources for individuals in our community, as well as filling those gaps and increasing the reach of the community. Opioid settlement funds, many grants come from the restricted account of these funds, but we do have a second account, which is the unrestricted that Shelby mentioned. And from this unrestricted account there, we have deemed 2 uses. We use them for grant match dollars, like the DMHA opportunity, and contractual services. Contractual services include funding for my position currently. Previously, these funds were used to fund around half of my position, but as of June of this year, the commissioners authorized for my position to be fully funded through the unrestricted portion of those funds. And finally, I would also like to highlight the key role that our executive director at the Youth Service Bureau has had leading up to this process. Karen Branch has dedicated so much of her time building our LCC to what it has become today. Our LCC is thriving and continues to grow even bigger each year. Because of the years of work dedication that Karen provided, the Montgomery County Commissioners were already knowledgeable and involved with our coalition, and they have allowed us to continue to be authorized to use the opioid settlement funds due to that relationship that was previously created. And finally, I would also like to note that this process would not be possible without our amazing leadership team that we work with and our county commissioners. It is their dedication to our community, their efforts that have led the way to ensure the opioid settlement funds are being used in the best interest of our community. Thank you.
Well, thank you for presenting today, and I just want to applaud you guys for using your unrestricted funds in restricted ways. I think the state also shifts our administrative costs to unrestricted, and I think that's a great way to ensure that we are putting 100% of our restricted funds to use in restricted ways. So thank you for that.
I also wanted to include, because I know Shelby has mentioned that other communities are trying to get their feet on the ground, getting momentum running. We recently have been working with Boone County, who is our neighboring county as well, to help them kind of get a committee oriented like ours is to help distribute those opioid settlement funds in future processes. And thankfully yesterday they were granted that authorization by their county council. So we are very excited to move forward with them and see how we can help. But that was it was a great win for us just to be able to work with other communities to help see what we can do to help and make sure that our communities are getting the dollars where they need.
Questions for Diane?
I've got a question. Okay, this chart that you included in the packet.
Yeah.
On the far right-hand side, you have high, so those are the high need, high priority
Yes.
areas.
Yes.
The second box, the third box down says intervention, treatment, recovery, and says jail does not use MAT, hospital does not use MAT, lack of treatment and recovery services for pregnant women and so forth and so on.
Yes.
Can you just enlarge on that, especially the MAT part?
Yes, so currently the Montgomery County Jail does not have any medication assisted treatment available. That's something we try to work towards, but as you know, it's a process to get those working relationships and to provide the education on why that is very necessary. I will say, over the past 3 cycles we've done, services available for intervention, treatment, and recovery have profoundly increased. We went from having 2 to 3 peers in our county to over 16 peers added in the last 2 years. So we are still actively working on that, and it's definitely a process, but we've made a lot of headway on that. But we're still working on making a positive relationship with our local hospital and our.
Yeah, do either of the courts sit as a blood court 1 day a week?
I don't know if it's 1 day a week, but we have a veterans treatment court, drug court, and a family.
So I'm just trying, so the defendants who've been convicted and they're in a drug treatment program, usually in cooperation with the county mental health folks, are diverted to a MAT in many counties. And, you know, you're arrested on Friday, you're detoxed over the weekend forcibly. I mean, there's no voluntary ban on Monday. You get your medically assisted treatment, and there've been that Doug has dealt with logistical issues with that, with the licensing board and all that stuff. But if you don't use it at all, you're not running. So what happens to the folks that are arrested on a Friday, released on their own cognizance that night or the Monday? Do they just go break into somebody else's house if they don't get mad?
We have, I believe, two community health agencies that offer that. We just don't do it through the jail. That's something we're working on. I'm not sure. if-
Okay, I'm not being critical. I'm just trying to get my.
Oh, no, So I absolutely understand. It's just something that we're definitely working towards, and that we fully understand that there may be gaps in that service area as well.
So I'm a little surprised that the hospital doesn't use that. In fact, I'm a lot surprised that the hospital doesn't, because that's one of the big systems.
Yeah,
It's a new building. You know, we got an ER that's pretty good. And so.
And again, the management of our hospital is outside of our community. That takes place at a higher level, and so I think sometimes decisions.
You mean down the street over here.
I mean Lafayette for us.
Over you as well.
Lafayette and Rensselaer, yes. So there is not always the same connection to our community and what our needs are as there may be in larger
I
areas.
tell you what, my family's from Montgomery County. I know the folks up there and in Mishawaka. There's no excuse for St. Francis Hospital not having, man, that's what, that's 2003. That is 2 decades behind. You go to the adjacent county here on drug court day and the mental health people are sitting in the jury box and the defendants are referred directly to them. And so if it's not happening in Montgomery County, do a little, let me know.
And again, being a rural community, our access to various health services, including medication assisted treatment, is more limited than it is in other areas. The two providers we have are private providers. I believe at least one of them is a for-profit corporation that is providing that service. So yes, we would love to make it more community-wide through our hospital, being able to offer that to inmates who are currently in the jail, but it is a slow process. We are still trying to get our local hospital to test for fentanyl when people come in for overdoses. They do not routinely test for fentanyl. And so then medical decisions are made without necessarily all that information being available to the physicians. The good thing is we have very collaborative relationships in Montgomery County, and they will at least hear us out, even if they don't necessarily agree with us. And we are making some inroads, particularly through our health department. Their health board has several retired members of the Franciscan Hospital Alliance who are working on our behalf to try and help us resolve those kind of issues.
But what you're saying is the decision makers in Lafayette.
Or Rensselaer. We don't even have a local COO who is dedicated full-time to our hospital. He is split between Rensselaer and Montgomery County.
Well, my dad was born in that hospital.
There you go.
So my grandparents and my great grandparents, there's no excuse for that. So anything I can do to help out, I mean,
We appreciate that. Franciscan is a wonderful health system. They just have different opinions and different ways that they view things. And again, the religious beliefs that are a part of the Franciscan system play a part in the decisions that they make on a lot of things. So
I'm familiar with that, but does that pertain to Matt? They told you that specifically.
no, they have not said that specifically.
But we are very happy that we have been able to improve the working relationship we have with the hospital. It hasn't always been a strong relationship, but thankfully over the last several years, we've been able to improve that greatly.
Thanks.
Just to, in the spirit of offering assistance, I know the Sheriff's Association has been working very diligently. So I know you guys aren't here to answer for the sheriff, but just to remember as a resource, the Sheriff's Association has been working with sheriffs all over in all counties to make sure that MAT is available to inmates to help people be more successful.
Thank you for that. And we are working, like Karen said, it's a very slow moving process. And so we're working with them to provide education and see what resources and funding opportunities we could lean on for that. But we're not giving up on that just yet.
How are you coordinating, or are you coordinating with a community mental health center that is responsible for your geographic?
Yeah, so Valley Oaks is our community mental health center. It's deemed by the county. That's Dale Crowder. He sits on our opioid settlement funds leadership team. He is a key player in the decisions we make. He's also part of JRAC. He's on every committee for our LCC. So he's there actively playing, representing their agency.
How are they collaborating with you?
In terms of making decisions for the funds
Well,
or these priority areas.
Dan referenced lack of treatment and recovery services for pregnant women.
Yeah, so we have, I think, 4 or maybe 5 different mental health facilities in our county. We are just still struggling with that ratio of patients to providers. Unfortunately, Valley Oaks being our community mental health center, sees a lot of turnover. There's a lot of wait lists going on. And so that's where those areas play into our priority areas. Through these funds and through a lot of the conversations we've had, they've been able to add peer recovery services for those who are uninsured or underinsured, as well as, forget what they call it, I think it's open access, so people don't have to be on a wait list for 6 months. But that's all been through collaboration through the opioid settlement funds process, as well as our LCC. But it's also a slow moving process, trying to improve that provider to patient ratio.
And our provider to patient ratio is about 1 to 958 in Montgomery County, with 5 mental health providers in the community. You know, people think a lot of it is uninsured, and it's not. We have insured folks, and the mental health centers do not have appropriately licensed professionals to be able to bill third party. And so people with insurance are going unserved in our community because they don't have the appropriate licensure amongst their professionals to be able to serve them. So it is a huge issue to be able to access. And then again, the mental health model is if you miss an appointment, then they drop you and you have to reapply, which again, for people struggling with substance use issues, missing appointments happens all the time. So it's an imperfect system, but Dale and the other providers in the community are really working to try and change that process so that we don't have people who have no access to mental health services.
And I will touch on the portion of the lack of treatment and recovery services for individuals that are pregnant. We have a Project Swallow program through our Mobile Integrated Health program. They've been able to significantly improve access to resources for those individuals, as well as our quick response team. So through that, we've been able to connect them, whether it's through Franciscan or an out-of-county program or service. That's been instrumental in helping us improve access for those individuals.
So if I said the words Indiana Pregnancy Promise Program, does that ring a bell with you?
It does not.
Yeah. And again, for any of you who may have heard our mobile integrated health team speak across the state and nationally, you know, they are seeing people within 24 hours of a patient appearing in the ER for an overdose experience. We have someone boots on the ground within 24 hours making contact with those folks. And especially if it would happen to be a pregnant individual, making a referral to our Project Swallow program, who takes down all the barriers to accessing those people because they're going to their home and meeting with them and providing the resources in a way that is accessible to them. So we are blessed to have the mobile integrated health and the quick response team as part of all of our collaborations.
I just wanted to say, the lack of transportation services, that came up in our maternal health meeting. We had, an interim as well. And I think that mobile integration is a way to fill that gap. But I was looking, I know we all get in our different silos, but how as a state do we improve transportation services in rural areas? And there are some ROI numbers out there. But I'm thankful to see that the mobile integration, that's a step in the right direction. And maybe if we can find a way to direct some of those funds to that, to fill in that transportation gap, it would improve those outcomes.
Definitely. And our quick response team is, and Mobile and Great Help has been instrumental in the increase of our services, and we're very thankful for that. We've had a couple of organizations that have attempted to champion a transportation project of sorts, but because we are so rural and we're kind of like a little donut with our outer towns being very far out from our city limits, it gets very complicated. And a lot of our agencies, unfortunately, are already at capacity with the services and programs they're providing. So we are trying to take whatever we can and make sure that we can offer the best services to our community. And if anyone has any ideas, though, we'll take them.
We have a program called Sunshine Vans that is the elderly and disabled transportation. And they have been able to grow and broaden their idea of who they can serve. And by appointment, can serve clients going to medical appointments, getting to the grocery store, getting to their mental health appointments. So there are efforts in place. It's just really, really hard in a rural community with no kind of public transportation. We don't even have Uber or Lyft in our community. We get gift cards that we could use for Lyft, but we have no Lyft. We have one taxi, so I hope you call early in the morning and are able to get on that schedule. But that is one of the constant challenges to helping people access services is transportation.
The Sunshine Vans, do they take Medicaid dollars? How do people who can't afford, how are they paid?
It is Medicaid dollars that they're functioning on. The new transportation they're going to do will be a free will donation for in-town trips. For out-of-town trips, they will charge by the mile, and they're trying to keep that low enough to make it accessible.
Well, thank you very much.
Thank you.
We'll now shift to the state's portion of the funds. Kelly Welker is the Director of Addiction and Prevention Services, Division of Mental Health and Addiction at the Indiana Family and Social Services Administration. And her team administers the state's portion of settlement funds in addition to federal block grant for SUD and the state opioid response grant from the federal government. Kelly?
Thank you, Chairman Hunsinger and members of the commission. Today I'm going to complement and highlight our state spending plan for state fiscal years 24 and 25. And then after me, Sarah Sailors, the Director of the Division of Mental Health and Addiction, will talk in a moment about the state's third spending plan that we will have. So as you can see, this plan is developed by Indiana Family and Social Services Administration's Division of Mental Health and Addiction in consultation with other stakeholders and state agencies throughout. Part of her code is we must submit our plan to Indiana State Budget Committee to be approved for approval. The last plan that we did was for a 2-year funding cycle, which is what I'm going to highlight today. And we kept those categories broad for prevention, treatment, recovery, workforce, and justice system. So starting off with our restricted or abatement funds for the fiscal year 24 and 25, I first want to highlight the memorandums of understandings that we have done with some of our other state agencies with the Office of Judicial Administration for 5 years. This was to help hire additional staff, training and technical assistance for the local JRACs, research and evaluation of problem-solving courts, pretrial services agencies, juvenile diversion programs, as well as other justice programs. We were also able to do a memorandum of understanding with the Indiana Housing and Community Development Authority. And this was to provide 4 localities, 4 providers to provide rental housing and supportive services to those with substance use disorder. And we have those spread throughout the state. So the 4 agencies will roughly be in Indianapolis, Fort Wayne, Brookville, and Terre Haute. Next, we did a memorandum of understanding with the Indiana Department of Health for 2 years. And this was to help support their Connect to Cure program, which is for hepatitis C testing and treatment. And finally, the last memorandum we did was with the Indiana Department of Corrections. And this was for 3 years to expand their medication assisted treatment, purchase curriculum and education materials, and train employees on substance use disorder. Moving on to some of the initiatives that we discussed for funding. We did an expansion of certified peer support professionals. And with that, we were able to add an additional 64 peers throughout the state, which is really what will help once somebody is in treatment. Those peers will walk alongside of them, help them with services, help them get into recovery and maintain that recovery. I want to thank Diamond because you did a wonderful job highlighting the match program that we initially did. So thank you for that. Our first iteration of the match is we reached out, provided a request for funding, had local communities submit to us what they needed within their community and had to provide match dollars. So Montgomery County did a great job of highlighting that. We currently are on a second iteration of that where we just released and have proposals in. At this time, we did one specifically for transportation, so hopefully that will help some of the local rural communities, as well as evidence-based prevention, and then capital expenses for recovery residents. As you can see, we also have previously done a capital expenses for recovery residents. As many of you know, federal funding or grant funding, oftentimes capital expenses are not allowable. With the settlement fund, these are allowable. So with that, we are able to add an additional 414 recovery residence beds throughout the state. And then lastly, use some of this funding to support evidence-based prevention and treatment programs. So here is a breakdown, and this is for state fiscal year 24 of the restricted or abatement funds. As you can see, a bulk of that was spent for treatment and recovery, and then also some with prevention. And these align all with the Exhibit E categories. And then state fiscal year 25, again, we have 88% within that treatment and recovery. 10% roughly with prevention, and then the other is what Shelby Thomas referenced when we contracted with Aegis to help with our local reporting. So that is the other category for that. And then unrestricted funds, the Division of Mental Health and Addiction is appropriated by the legislature each year, $9.1 million. So I want to highlight some of the initiatives that we have used for those. That is used to support evidence-based treatment in our community mental health centers and addiction providers, certified peer support curriculum, our regional recovery hubs. So we have 10 hubs throughout the state that employ peers that will work with individuals to help them with whatever they need supportive services wise. So that is navigating the criminal justice system, maintaining how to develop those social supports, as well as recovery community organizations. And then, unfortunately, I do hear a lot of times in Montgomery County, the state does offer lift rides through 211 in our regional recovery hubs to help those get into appointments for recovery and treatment. So just for state fiscal year 25, between both 211 and the regional recovery hubs, we were able to offer over 14,000 rides to services. And then the Office of the Governor receives $5 million each year appropriated by the legislature. So some of those initiatives that we covered, and I want to thank Bernice because you highlighted very well. One of them is substance use disorder treatment in jails. So we work very closely with the Indiana Sheriff's Association and trying to provide kind of that training and technical assistance to the sheriff. So I would be more than happy to meet it. Your sheriff is open to that. To discuss the program and what that looks like as the funding available to help support that. Also used to support a statewide addiction treatment locator throughout the state. Again, the expansion of those certified peer support professionals. And then the Bella Seal program, which is a Mental Health of America program that supports recovery from workplaces. And at this time, I'm happy to answer questions.
Person?
Yes.
Thank you. The 201, you said you got 14,000 riders that you guys did in the fiscal 2024? Or the 2024 calendar year?
It was 2025.
2025.
Yes.
Do you have that by county by any chance? Like those numbers?
We do get a breakdown of location, so I should be able to at least pull it by.
I would appreciate you to tell my office, Lake County. I'm interested to find out in my area how many of those were flipped.
Okay,
We can continue to support that initiative.
okay. Can you remind me like what counties you would be in?
Lake County.
Lake County, okay,
Yes, Lake County. Thank you.
yes, absolutely.
Any other questions?
Thank you.
Good morning. First, I want to thank Shelby and Kelly for their work on these, dollars. They really do carry the lion's share of the work to make sure that the state is moving in the right direction. So thank you all for your continued work and efforts around that. As you know, the last couple of plans that we had a really focus on the infrastructure around the treatment and recovery. And so we feel like those two plans have really set us up well for some success. We've seen some, early indicators of good outcomes. Specifically, I think recently the CDC released preliminary data indicating that Indiana has seen a 23% decrease in our overdose rates from April of 24 to April of 25. And so that's been really instrumental from the work that's been done around these two plans. But we also know that there's more work to be done. So we've started to have conversations with lots of stakeholders. We're talking to providers. We're talking to those with lived experience. And we believe it's time to really start to focus on that next generation and looking at our youth who are impacted by SUD. As you know, it's probably not a secret that youth who have parents who have SUD are at higher risk for high levels of anxiety, high levels of depression, poor school outcomes, educational difficulties. We also know that they're more likely to develop SUD disorders themselves. And so we want to be prevention focused in our next plan. We want to think about how to fill those gaps for those youth in Indiana. And we hope that we'll be able to really kind of move the needle for them and see improved academic performance. We want less youth involved in the juvenile justice system. We want less youth engaged in substance use themselves. And we would really hope to see improved outcomes around our suicide rates for youth here in Indiana. So with that, we are also very open to hearing what others think about that plan. We do need to think about presenting that plan to the budget agency in the spring of 2026 so we can get moving on the next contracts and making sure we can get those dollars out. So if you have ideas or thoughts that you would like to share with us, we are open to hearing that. Please reach out to myself, to Shelby, or to Kelly. They didn't know I was going to offer them up, but yeah, any of us would be willing to hear your thoughts and ideas around that population. So any questions?
Thank you, Sarah.
Yeah.
I have a comment more than a question. So last time I was here, for those of you who didn't know, it's second tour of duty. Almost all of the dollars that we spent in substance abuse disorder were spent through DMHA, either directly or through the community mental health centers. Last year, we spent $600 million on substance abuse disorder treatment in Medicaid. So it dwarfs what we're spending in any other portion of the of our agency or of state government in general. That represents both in Hoosier Health Wise, which is, for those of you who don't know, that's pregnant women and children, and in the HIT program. That's where the majority of those dollars are spent. A commercial population, so if you were to hit the Indiana state government as an example, that spends about what's called $3.80 per member per month on substance abuse disorder. In the HIP program, we spend $38 per member per month on substance abuse disorder. So it is a huge differential. And I don't think we have, candidly, I was unaware of that. Maybe I was naively believed that the HIP population was a population which was similar to a commercial population. I had been disabused of that notion. So we'll be spending a lot more time understanding where we are spending all those dollars and evaluating what return we are receiving for those dollars. For those of you who don't know, we do a quarterly financial review. Sarah and her team, along with OMPP, will be presenting about how what our drug spend looks like today and how we might be evaluating that and hopefully getting better outcomes prospectively.
Mention, Sarah, is that data available in a way in which you can trace it to Matt?
The CDC data.
Well, so Montgomery County doesn't have Matt.
Oh, yeah.
Did you have a cell in your spreadsheet?
Yeah,
Okay,
yeah, we can tell you how much we're spending on that.
but you don't know by all count.
Oh, yeah, yeah. I mean, we could, because it comes in on a claim.
Yeah, so Montgomery County presumably will be submitting almost no claims.
Presumably, yeah, I don't,
Private practitioners and
I don't know that.
public entities don't. I'm just trying to understand if it's a big problem or a little problem.
Yeah.
Because Matt, we've been talking about since day one of this commission, and there was professional pushback to it at the beginning. That is many professionals. And then the second thing was licensure issues. It was a pain in the neck to get licensed to distribute. And the third thing was this fictitious character I just made up that was arrested on a Friday and Monday gets a prescription filled on Thursday. And in the meantime, his problem requires him to go break into somebody else's house until Thursday, and then he sells his prescription. It has value and gets cash out of that. So I'm just trying to figure out, is this Montgomery County problem or 50 of 92 counties have this challenge? Let's not call it a problem, let's call it a
Challenge, yeah.
challenge. In Clinton County, for instance, the drug czar visited there, happened to be at a meeting, and he had the data in his hand of Narcan distribution in Clinton County. So he knew how many units had been taken back and not used over time. And he extrapolated from that improvement in what you call the disease state in that county. And it was a group like this, and everybody in the room knew what he was talking about. So it was clear there had been an effort to both get Narcan distributed and then to go for a more root cause issue.
Right.
I apologize, I have an opportunity for service in a different location, so.
Oh,
Thank
excellent.
you very much.
Representative?
Is there a question?
Yes, Sarah. You were talking about how you guys are focused with the youth and helping them out with SUD
Yeah.
education. Are you guys doing any partnership with the Department of Education, in working with them in some type of program for the schools?
Yeah, so as we develop this plan, the next iteration of the plan, we are definitely with lots of our different sister, even what I would call our sister agencies, right? Trying to engage in conversations with them. Whether it's, I serve on the Youth Justice Oversight Committee, we have Department of Education who's represented on those councils. We have a lot of crossover, and internally within our own division, we partner with them quite a bit to hear where they are in the landscape of this and the challenges that they face day in and day out. And
Sure. Let me ask the question again. Are you guys doing, is there any program, is there any type of right now initiative with Department of Education for the schools? Is there some type of program out there?
that's specifically around SUD.
Yes.
Yeah, so we do have some prevention programs where we partner, and I can probably speak to the exact terms of them, but we do have programs in schools around this and other prevention, whether it's our smoking cessation
programs, our alcohol programs, our, yeah, probably one of the most popular is Too Good for Drugs. We currently have, through our substance use prevention, treatment, recovery block grant, 20% of that has to go towards primary prevention. So we have 32 community grantees, that will provide evidence-based prevention programming. And again, like BOP and life skills and Too Good for Drugs are probably two of our most popular that are utilized in the schools.
Okay, anything about screening the students prior, let's say, prior to the school year to see if there's any behavior with substance abuse and how you guys could prevent that going forward with the schools?
There are youth surveys. There is some limitations to that because it is dependent upon if the school wants to administer those surveys.
Okay. The reason I ask is I had legislation that I filed this past session, House Bill 1305, for mental health screening and substance abuse for students K to 12. I would like to see some collaboration. That way we could partner. I'm going to bring this legislation back again, but I really think that we could be preventative in helping our youth. We see unfortunately what's going on in our nation. This school year, we already had the Colorado shooting, Minnesota. And so how do we become proactive instead of reactive? And a way we could do that is before the students start, just like they do screening for other stuff, right? They're reading, learning, we have optometrists to check their eyesight to make sure they're having the good vision. Why not do something when it comes to mental health and substance abuse? Like that, we could see from the beginning, if there's an issue, we could start working with them and their parents. And it's a made provision, so it's not a shall. So any school corporations that want to opt into this program, they can. And also, in the language, it's parent friendly or guardian friendly, because a lot of times people say, well, I don't want my child without my consent. So that also allows the parents to say, hey, we want to opt into allow our children to do this. And then once the report comes out, you could give it to the parent or the legal guardian, and then they could be able to assess, okay, where do we have to move forward with our child to give them the type of service that they need, so that we're trying to prevent some tragedies and help. So, any collaboration on that would be appreciated. We could probably talk about this after the meeting, but I have legislation. I think we could collaborate and be able to help our youth.
Thank you.
Thank you.
Thank you. Any other questions? Thanks, Sarah. Finally, Shelby Thomas is going to provide us a brief report on behalf of the Indiana Criminal Justice Institute on the state's local coordinating councils. The institute is statutorily required to provide a quarterly report to this commission summarizing the efforts of local coordinating councils which operate under the institute's administrative oversight.
Thank you, Chairman Hunsinger. In addition to overseeing the local coordination of the opioid settlement funds, for the last 6 months, I've led the Institute's Behavioral Health Division, which manages Indiana's local coordinating councils for the LCCs, which you heard Diamond reference quite often. So community-driven solutions are what drive meaningful results, and our LCCs really play that vital role in shaping the local responses to substance use. These are county-level coalitions that bring together volunteers from across various sectors like education, treatment, social services, and law enforcement to develop plans and coordinate efforts to address substance use in their communities. LCCs also serve as stewards of the drug-free community funds in their county, which are supported by local fees from alcohol and drug offenses. 75% of these funds stay with the county, while 25% goes to the state. And so before accessing these funds, each LCC must submit an annual comprehensive community plan to ICGI for approval. This plan essentially guides their work and outlines local needs, sets measurable goals, and details how funds will be used to achieve these goals really across 3 program areas. So prevention and education to the representatives with treatment and intervention and justice services. By statute, LCCs must award grants in all 3 of these categories, ensuring a balanced community approach. ICGI reviews and approves these plans and provides technical assistance throughout the year to help really ensure success. Currently, Indiana has 89 active LCPs utilizing a combined $52 million in drug-free community. This funding is distributed fairly evenly across the 3 program categories, with about 26 to 27% each for prevention, treatment, and justice services, and that remaining 20% supporting administrative costs. So essentially, how are these dollars being used? In prevention, school corporations are leading the way with evidence-based programs like Kelly mentioned to reduce youth substance use. And we encourage braiding those funds. So the funding that they may receive from DHA, we encourage them to look at how they can also utilize their drug-free community funds to ensure maximum impact. In treatment and intervention, funds support recovery centers, client services, and mobile crisis response. And then in justice services, funds help community corrections and problem-solving courts, to Montgomery County's point, to really enforce positive behaviors and reduce recidivism, while local law enforcement also receives funds for interdiction efforts. So as we prepare for the 2026-2027 funding cycle, which will really be my first cycle from the beginning, our division is currently reviewing processes to both meet our statutory obligations, but really reduce the administrative burden on local coalitions. This includes streamlining reporting requirements, ensuring that we collect meaningful data and find better ways to share insights back with the counties. Starting this month, we're relaunching our webinar series and hosting regional calls to help counties learn from one another instead of reinventing the wheel. And while ICGI does not directly administer LCC funds, we provide guidance, promote evidence-informed strategies, and strengthen coordination with other state agencies who are working in this space. Finally, our LCCs continue to face challenges similar to what we've heard throughout the morning, particularly around funding stability, community engagement, and awareness. Deposits fluctuate year to year depending on how many fees they collect, and participation can be uneven across sectors. And there's sometimes a lack of understanding in the community as far as what an LCC's purpose really is. But despite these challenges, our LCCs remain a core part of our community-based response to substance abuse. And their work really reflects what we have pushed for all along here at the state, which is that local collaboration. This time, I am happy to take any questions.
All right, well, thank you to our president and our commissioners for your time. We're working to schedule our 2026 meetings, and we'll distribute that in December. If there's no other business to come before the commission, we stand adjourned. Thank you.